My name is Gabrielle Chen. I'm an undergraduate student at the University of South Florida, and I'm so excited to talk to you today about redesigning the radiation oncology elective for surgical oncology fellows and exploring the idea of if more structure would be beneficial. So currently there is a requirement for surgical oncology fellows to complete an elective rotation in both medical and radiation oncology for 1 month, 2 weeks in each subspecialty. But there is no standard curriculum for this rotation across U.S. training sites, which led to our study focusing on the exploration of different educational elements and the structure of this rotation that would enhance the value of this experience for the fellows. So our hypothesis was focused on exploring the feasibility and acceptability of adding more structure to the radiation oncology elective for the surgical oncology fellows. Our methods included interviewing 3 surgical oncology fellows, 2 radiation oncology attendings, and the radiation oncology program director at Moffitt Cancer Center. So specific questions were asked regarding the value of obtaining baseline measures of knowledge before and after the rotation through pre and post surveys, and the qualitative interviews were carried out to determine the effectiveness of the current experience, what the trainees felt were missing, what could be improved upon, and whether more structure would be beneficial. A variety of educational material was reviewed with the trainees, including things like podcasts, videos, slide decks, PowerPoints, and written articles. So for the results, through the methods described previously, there was a common consensus among interviewees that a 2-week clinical rotation in the specialty of most interest to the fellow with supplemental material in the form of relevant literature, podcasts, and visual flowcharts would be the most beneficial overall. All people surveyed felt that a checklist of general radiation concepts and a pre-survey would aid in outlining the learning goals, and a post-survey at the end of the rotation would reinforce the learning points and ensure that those required elements were properly communicated during the rotation. So for the content perceived as the most instrumental for the fellows to learn throughout the rotations was emergencies in radiation oncology, especially and specifically those leading to surgical interventions, how radiation therapy affects the body pre-surgery, an understanding of symptoms related to the timing of treatment, and a general timeline of scheduling and treatment plans in radiation oncology. So in conclusion, based on this exploratory study, we found that surgical oncology trainees do desire more structure in their radiation oncology elective. A baseline survey before the rotation would serve as a guide to communicate the goals to be achieved during the course, along with a tailored course curriculum focusing on those core elements of radiation oncology and their subspecialty of interest. The checklist, pre and post survey, an assortment of podcasts, literature, and visuals, which would be tailored to the surgical oncology fellows' subspecialty of interest, warrant further exploration and more investigation. Thank you for your time.